Temperatures are obviously here, and while it may be tempting to soak up lots of sun, it's important to make sure that we protect our skin and make sure our bodies don't overheat. So here to tell us more about sun safety is Nurse Christina Paris from the VA. Good morning.
Hi, good morning.
Well, thanks so much for joining us as always. And first of all, just tell me about the basics of sun safety, and could you explain what UV is?
Absolutely. So sun safety, you know, the sun has a lot of really good qualities to it. It boosts our energy and improves vitamin D absorption, helps our bones, helps us sleep, improves metabolism, but it can be bad too. So it does, like you said, have those negative UV effects. And sun damage can occur in all types of weather. So in winter, even overcast, you can get sunburn. So what UV is, all radiation is a form of energy, and most energy is invisible to the human eye, and UV is just a type of radiation. We measure it on an electronic magnetic spectrum. So we look at the UVA, which is the most dangerous, and the rays can go and penetrate the longest or furthest, so they can get the most deep into our skin and cause the most damage. Then there's UVB and UVC. Those don't quite go as far. Usually they're absorbed in the Earth's ozone layer, but some UVB can go deeper and cause skin damage. So you definitely want to look at those, the UV index when you're going to go out into the sun. Now, the forms of damage that it can occur, some may feel just like they have sun poisoning, which is really photodermatitis, so it's a rash, but some people might just feel sick, chills, nausea, fever, joint pain, things like that. And people who are at higher risk for those kind of things are people with pale skin, blonde hair, red hair, light brown, anybody who's been treated for skin cancer or has a family history of skin cancer, really want to take precautions.
Right, and like you mentioned, I think a lot of us maybe forget to be extra careful on overcast days, or even in the winter and early spring and things like that. But like you said, the sun can be a factor year-round. So you mentioned some of the sun damage that can affect us. How can that affect our overall health?
So there's no such thing as a base tan. So to prevent sun damage, you want to lessen your chance of burning. So melanin, that's what gives us that nice bronzy tan, which I know we all like the look of. It actually, the purpose of melanin is to cover the nucleus of our cells. So it's there to protect us from damage. So if you see it, you're starting to cause damage to those cells. Sunburned skin is damage from ultraviolet light, and it can take up to 24 hours to appear. So you might be out in the sun even for 15 or 30 minutes and not think you did a whole lot, but the more as the day goes on, you're going to feel that effect of that sunburn. So the bad things about the sunburn, like I said, besides, it damages those cells, so it can cause skin cancer. And especially if you have an abnormal little growth and you notice when you pick it, it can bleed. And we can do a whole nother segment on skin cancer, but those are things you want to make sure you seek care with your provider. But it can also cause premature aging, those age spots, cataracts, which is like a clouding of the vision. So it's like looking through a frost-covered windshield all the time. And so you want to take precautions.
All right, yeah, lots of ways that the sun can affect us that we might not always think about. So what are the best forms of sun protection to make sure that these things don't happen? And if you do get a little too much sun, what are some home treatments?
So early detection, don't burn, avoid sun tanning beds, especially between 10 and 2. Generously apply sunscreen. So SPF stands for sun protection factor, and you want greater than 15. And believe it or not, you need to apply that every 20 to 30 minutes, because every time we jump in the lake or we're out fishing and sweating, we that's coming off of our skin. So we need to reapply. Actually, SPF was introduced in 1962, which I thought was interesting because I was born in the 70s and we still use baby oil. But anyway, don't do that. Use SPF. You want to wear protective clothing. Wear sunglasses with UV 400 or 100. And the side guards are good, especially if you're going to be out fishing on those lakes. Seek shade. Use caution, and there's other safer ways to get vitamin D. Now, if you get sunburned, don't pop any blisters because that can cause infection. Your body will reabsorb that. Use ice packs to those areas. Aloe vera. Apply moisturizers. Keep your skin clean. Cool oatmeal baths are good. And Noxzema, while that's probably not a medical one, always one I used when I was a kid and whenever I get sunburned or back pain.
Well, that's great. Aloe vera is definitely a go-to for me if I ever get a little too much sun too. So great things to keep in mind and very relevant right now, especially this week with our heat wave going on. So thank you so much and we really appreciate it. We'll talk to you next week.
Absolutely. Everybody stay safe.
You too.